We are joined now by Dr. Ashish Jha, Dean of Brown University School of Public Health. Dr. Jha, good morning. Thanks for being with us again. As we just heard, Moderna's vaccine was found to be nearly 95% effective and appears to be more easily transportable than the Pfizer vaccine. What do you think that means for the months ahead here?
Yeah, good morning, and thank you for having me on. This is very good news. We are entering the hardest time of the pandemic. I think the next 2-3 months are going to be awful across the country. But what the Pfizer vaccine, what the Moderna vaccine do is give us hope that in a few months, this will really start turning around. The light at the end of the tunnel just got a little bit brighter.
Are there any logistical challenges that concern you about distributing the vaccine?
Yeah, there are. I mean, first of all, it's good, and it's true that the Moderna vaccine is a little bit easier to transport. There's still a lot of complicated issues. I mean, we've got to get tens of millions of vaccines out to states, to pharmacies, doctors' offices. That needs a lot of planning. There has not been a lot of that planning happening out of the federal government right now. There's been some, but we need a lot more of that. And then we're going to need to hand that off to the Biden team, who's going to have to pick it up and run with it. So there's a lot of logistical challenges in front of us.
How quickly do you think this could get us back to something even close to normal?
Yeah, I think we're looking at, look, even if we have 10 or 20 million people getting vaccinated over the next few months, we really, until we get to 50, 60% of the American population vaccinated, and that's at best case scenario, April, May, I think, we're still some ways away from something that'll be the new normal.
As you said, the next through a few months look really quite dire. How much worse do you think this can get, and what do we need to do?
So unfortunately, based on all the numbers I am seeing as of today or as of yesterday, it is going to get meaningfully worse than we are in right now. The bottom line is that hospitals are at capacity, and they're still about to get a flood of new patients. So it's going to be even bigger and wave of patients. So I'm very worried about the next month. We know what we need to do. Everybody needs to wear a mask. We need to avoid any kind of indoor gathering. And then states have to do more on testing. And if we can help states do that with some money from the federal government, I do think we can stop this from getting dramatically worse, but some of it is already unfortunately built in.
Michigan has instituted a 3-week pause on things like indoor dining and in-person learning. Is that enough? Do you think that's something that needs to be widespread?
I think every state should be following Michigan's lead right now. Michigan is really doing what is absolutely essential, and it's amazing to me that other states are not following. I suspect that this week we are going to see a lot of other states step up and essentially put in very similar policies because we're so behind the 8 ball that we've got to get going.
All right. Dr. Ashish Jha, thank you again for being with us this morning. Appreciate it.
Thank you.